In 2003, there are about 84 million population expected to grow annually at 2.36%, with a rate the population expected to double in 29 years. The 2003 total fertility rate in the country remains at 3.5 children per woman, much higher than the desired fertility rate at 2.5 children per woman. The contraceptive prevalence rate has increased gradually from 15.4 in 1996 to 48.6 in 2003. In 35 years, there are about 3 to 4 women getting pregnant every year. In developing countries, about 85% of the pregnancies are expected to progress full term. According to the World Health Organization, or the WHO, family planning is defined as the ability of individuals or couples to anticipate and attain their desired number of children and spacing and timing of their birth.
The family planning methods. There are different types of family planning methods used to prevent pregnancy. So let's start with the female sterilization. Female sterilization is a safe and simple surgical procedure which provides permanent contraceptions for women who do not want more children, and also known as bilateral tubal ligations that involves cutting or blocking the two fallopian tubes. So female sterilization has advantages and disadvantages. So let's start with the advantages. So first is permanent methods of contraceptions. A single procedure leads to lifelong, safe, and very effective contraception. Second, nothing to remember, no supplies needed, and no repeated clinic visit required. Third, does not interfere with sex. Fourth, results in increased sexual enjoyment, no need to worry about pregnancy. Fifth, no effect on breastfeeding, quantity and quality of milk not affected. 6. No long-term side effects or health risks. 7. Mini laparotomy can be performed after a woman gives birth. The disadvantage of female sterilizations is uncommon complications of surgery, infections or bleeding at the incision site, internal infections or bleeding, injury in internal organs, anesthesia risk uncommon with local anesthesia. Second, in rare cases, when pregnancy occurs, it is more likely to be ectopic than in a woman who has not undergone the procedure. Third, requires physical examinations and minor surgery by trained service provider. Fourth, requires an operating setup. Fifth, permanent reversal surgery is difficult, expensive, and not available in most areas. 6. Do not protect against sexually transmitted infections including HIV and AIDS. 7. Clients may have limitations in physical activities such as heavy work and lifting heavy objects immediately after surgery. Second is the nail sterilization. Nail sterilizations is a permanent method wherein the vas deferens is tied and cut or blocked through a small opening on the scrotal skin. It is also known as a vasectomy. So nail sterilization has also advantages and disadvantages. So let's start with the advantages. It is very effective 3 months after the procedure. Second is a permanent, safe, simple, and easy to perform. Third, can be performed in a clinic, office, or at a primary care center. Fourth, no resupplies or repeated clinic visit. Fifth, no apparent long-term health risk. 6. And options for couples so female partner will not undergo permanent contraceptions. 7. A man who had vasectomy will not lose his sexual ability and ejaculation. 8. Does not affect male hormonal function, erections, and ejaculation. 9. Does not lessen but may actually increase the couple's sexual drive and enjoyment. 10. The man can have little sex since he does not fear that his partner will get pregnant. So the disadvantage of male sterilization is it may be uncomfortable due to slight pain and swelling 2 to 3 days after the procedure. Second, reversibility is difficult and expensive. Third, bleeding may result in hematoma in the scrotum.
Mucus, billings, ovulation. Description or uses. Abstaining from sexual intercourse during fertile days prevent pregnancy. Advantages. Can be used by any woman of reproductive age as long as she is not suffering from unusual disease or condition that result in extraordinary vaginal discharge that make observation difficult. Disadvantages. Cannot be used by women with the following conditions. Medical conditions that would make pregnancy especially dangerous. How it is used. Recording of menstruation and dry days. Inspecting underwear regularly for presence of mucus. Recording the most fertile observation or characteristic at the end of the day. Percent of effectiveness. Perfect use is 97%. Typical use is 80%. Basal body temperature. Description or uses. BBT mention is identifying the fertile and infertile period of woman's cycle by daily taking and recording of the rise in the body temperature during and after ovulation. Advantages. Very effective. Disadvantages. Requires to take BBT every day and take time to record temperature. Couples may practice abstinence during fertile periods. How it is used. Thermometer is placed in axilla or under the thigh to get the temperature at least 3 hours of undisturbed rest during or throughout the menstrual cycle. Percent of effectiveness. Perfect use is 99%. For typical use is 80%.
Injectables. Injectables contain synthetic hormones, progestin which suppresses ovulation, thickens cervical mucus, making it difficult for sperm to pass through and changes uterine lining. Injectables has advantages. First, revisable. Second, no need for daily intake. Third, does not interfere with sexual intercourse. Fourth, perceived as culturally acceptable by some women. Fifth, private since it's totally dependent. Sixth, has no estrogen-related side effects such as nausea, dizziness, nor serious complications such as thrombophlebitis or pulmonary embolism. Seventh, does not affect breastfeeding quality and quantity of milk not affected. 8. Has beneficial non-contraceptive effects. Now let us know how it is used. So injectables is a drug containing progestin. It is injected into the body to suppress ovulations, making sperm difficult to pass through uterine lining. Lactating amenorrhea method or LAAM. It is a temporary introductory postpartum method of postponing pregnancy based on physiological infertility experienced by breastfeeding women. Lactating amenorrhea method has advantages and disadvantages. So let us start with the advantages. First, LAAM is universal available to all postpartum breastfeeding women. Second, using LAAM protecting from unplanned pregnancy begins immediately postpartum. Third, no other FP commodities are required. Fourth, it contributes to improve maternal and child health and nutrition. The disadvantage. First, considered as an introductory short-term FP method which is effective only for a maximum of 6 months postpartum. Second, the effectiveness of LAM may decrease if a mother and child are separated for extended periods of time. Third, full or nearly full BF may be difficult to maintain for up to 6 months due to a variety of social circumstances. Fourth, disadvantage to women who do not pass any of the 3 criteria to practice lactation amenorrhea. So how it is used? Amenorrhea. Second, full of nearly fully breastfeeding her infant. Third, infant is less than 6 months.
Symptothermal method. Symptothermal method is identifying the fertile and infertile days of the menstrual cycle, as determined through a combination of observations made under cervical mucus, basal body temperature, recording, and other signs of ovulation. Standard Days Method, a new method of natural family planning in which all users with menstrual cycles between 26 and 32 days are counseled to abstain from sexual intercourse on days 8 to 19 to avoid pregnancy. The couples use color-coded cycle beads to mark the fertile and infertile days of the menstrual cycle. There are advantages and disadvantages. Advantages: first, no health-related side effect associated with its use. Second, increases self-awareness and knowledge of human reproduction and can lead to a diagnosis of some gynecologic problems. Third, no need for counting or charting since the Standard Days method makes use of beads for tracking the cycle days. Fourth, can be used either to avoid or achieve pregnancy. Fifth, very little cost and promotes male partner involvement in family planning. 6. Enhancing self-discipline, mutual respect. 7. Provides opportunities for enhancing the couple's sexual life. 8. Can be integrated in health and family planning services. 9. Acceptable to couples regardless of culture, religion, socioeconomic status, and education. 10. Not dependent on medically qualified personnel. The technology can be transferred by a trained autonomous user. 11. Once learned, may require to further help from healthcare providers. The disadvantages: cannot be used by women who usually have menstrual cycle between 26 and 32 days long. So, how it is used? First, abstain from sexual intercourse during fertile period. Second, use color-coded beads to mark the fertile and infertile periods.
Pill contains hormones, estrogen and progesterone taken daily to prevent contraceptions. Percentage of effectiveness: it has 99.7% in perfect use and 92% in typical use. Advantages: safe as proven through extensive studies and convenient and easy to use. Make menstrual cycle occur regularly and predictable. Reduces gynecologic symptoms such as painful menses and endometriosis. Reduces the risk of ovarian and endometrial cancer. Reversible, rapid return to fertility, and does not interfere with sexual intercourse. These advantages: often not used correctly and consistently, lowering its effectiveness. Has side effects such as nausea, dizziness, or breast tenderness, which are not generally harmful but which some women may find difficult to tolerate. May pose health risk for small number of women. Offers no protections against sexually transmitted infections. Effectiveness may be lowered when taken with certain drugs such as rifampicin and most anticonvulsants. Can suppress lactation and requires regular resupply. Male condom: a thin sheath of latex rubber made to fit on a man's erect penis to prevent the passage of sperm cells and sexually transmitted disease organisms into the vagina. It provides dual protection from STIs including HIV, preventing transmission of disease microorganisms during intercourse. Percentage of effectiveness: it has 98% in perfect use and 85% in typical use. Advantages: safe and has no hormonal effect. Protects against microorganisms causing STI and HIV. Encourages male participation in family planning. Easily accessible. Is used in managing premature ejaculation. Disadvantages: it may cause allergy for people who are sensitive to latex and lubricant. It may decrease sensation, making sex less more enjoyable for other partner. It interrupts the sexual act. It requires a man's cooperation for its use.
Family planning aims to contribute to reduce infant deaths, neonatal deaths, under 5 deaths, and maternal deaths. It addresses the need to help couples and individuals achieve their desired family size within the context of responsible parenthood and improve their reproductive health to attain sustainable development. It also ensures that quality family planning services are available in DOH-retained hospitals, LGU-managed health facilities, NGOs, and private sectors. Proper counseling of couples and the importance of family planning will help them inform on the right choice of the family planning methods, proper spacing at birth, and addressing the right number of children. Birth spacing of 3 to 5 years interval will help completely recover the health of a mother from previous pregnancy and childbirth.
Planned Parenthood has the right to operate. Planned Parenthood has the right to provide family planning services. We believe in funding family planning because it helps prevent